Hi guys, so today I thought it would be good for me to do a video on how to deal with the death of a patient whilst on shift, or just in general as a student nurse, a healthcare professional, and just anyone else that might find this video useful. So I've got my iPad with some notes that I've written down and some advice that I've got from other nurses who have also been in that situation and what they do. So the first thing is having a hot debrief straight away. So a debrief is basically after the incident has happened, after the patient has passed away, all the people that were involved in that resource situation or that patient's care prior to them passing away, and when they did pass away, you guys basically you'll basically have a quick discussion about how you felt in the situation, what you did well, what the history of the patient, the observations, is everyone okay kind of situation. Everyone's gets the opportunity to voice out their concerns and their feelings. It's important to have it straight away because you don't want anything harboring in your mind. Then later on, there's another debrief that happens that's planned, and that's with the multidisciplinary team. So the health visitor, the social worker, the coroner, any doctor involved, the consultants, where they have a thorough discussion and in-depth discussion about why the patient presented to A&E, or what was their care plan during the time on the ward. Did they miss anything out, or was anything skipped? What did they do well? What medication did they give? Did this have an impact on the patient passing away? Were the parents known to social services? Was the child known to social services? All these things are discussed in the debrief, especially for children, because no child should pass away at a young age. So they have this discussion to find out what could have caused a child's death. If the parents were neglecting the child, were they known to social services? Did they have a health visitor visit prior to them coming to A&E, or was their condition something that was monitored while they were on the ward? Was any observations missed out? So they just try and find the key point to the key things that caused the death of the child. So in regards to what I discussed earlier as well, for student nurses, I think it's very important that you do have a debrief with your mentor or any nurse in charge on the shift, because it's something you've never experienced before, and it's a way of releasing your emotions. And going off that point, I would say it's okay to cry. Crying doesn't make you worse of a nurse. Crying doesn't make you look like you're a weak nurse. It's okay to cry as long as the parent is not the one holding you down, because they also need to mourn the death of their child. So I would say it's important to let your emotions out. If you need to go for a cigarette, go for a cigarette. If you need to cry, go and cry. If you need to go for a walk whilst on shift, please do that, because you're expected to then carry on your duties as a nurse or medical professional. So I would say cry in that moment, as long as the parent is not the one holding you down, because you're meant to be the person supporting the parent. As a student nurse, if you need to go for a break, please go for a break. If you need to talk to the matron, the nurse in charge, your mentor, please do it. If you need someone's shoulder to cry on, I'm sure any of the nurses there will be happy to give you their shoulder to cry on. Crying does not make you less of a person. Crying does not make you look silly. Crying shows you're actually a human being who has emotions, and as nurses we do have to show empathy, and it's okay for us to cry because we're humans. Who wants to be a part of experiencing or watching a patient pass away, or an emergency situation? You've put so much effort into trying to sustain the patient's life, in trying to get their life back to normal, or trying to make them stable, and they pass away. That's a shock to the system. That's a lot to take in, because what we see in the hospitals, not everyone else sees that, and it's a shock to the system. I think people don't realise what nurses and doctors, even porters, the porter that's carrying the dead body to the mortuary, the coroner who is trying to investigate the cause of the death, the nurse who was a scribe or giving the medication or putting the line in or even leading the resusc, the person scribing, the person timing. People don't understand what it feels like in that moment. It feels like a second, but the whole resusc could be running for 1 or 2 hours, but no one understands how much of an impact that has on the person. So if you need to cry, please do. As I said earlier, speak to your friends and your colleagues at work. There's nothing wrong in there's nothing wrong in discussing how you felt in that moment. There's nothing wrong in going through it from the beginning to the end. There's nothing wrong with you speaking your truth or speaking your emotions or letting it out, because at the end of the day, we're a team. And as nurses and doctors, we work together. And I feel like it's so important, if you need to speak to a doctor or a nurse that was involved in that situation, or a nurse that wasn't involved in that situation who wants to be a listener, please do. Student nurses, I would say speak to your mentor. Even if you need to speak to your lecturer, please do, because you need to just let it out. You don't want to harbour it in, and it's an experience that nobody expects to be a part of or to see. You don't really think about, as a nurse, you don't really think about, I might be involved in the death of a patient or trying to save a life. You're more like, we're used to thinking that as nurses, we want to make the life of the patient or the health of the patient much better, not be a part of them passing away. So I would say speak to your colleagues, speak to your friends who may understand the situation and not judge you. And if you need to speak to your mom, your dad, your parent, obviously keep ensuring that you keep confidentiality in the process of talking to them. But, express how you feel, express your emotions, because at the end of the day, you're a human being, and it's okay to speak to somebody. And in some hospitals, they do have some support in place where you can speak to somebody, or there's agencies out there where you can speak to them about how it's affected your mental health. So please do check your trust intranet to find out these services that are available for anyone who is going through the difficulties of understanding and trying to process the death of a patient, because we're human beings again, like I said, and it's something that's really hard to just process at times. Sometimes you go home, you can't sleep with the light off, you can't sleep properly because it's still in your head. So I would say speak to somebody, friend, colleague, or check if your trust has any agencies or services available where you can speak how you're feeling, and they can give you some tips and advice on how to maintain your mental health while still being a nurse or student nurse or medical professional. So I asked one of my colleagues the question about how do they deal with the death of a patient, and she's a very, very, very senior nurse who has years of experience, and she says till this day she still sleeps with the light on. It makes it easier for you to sleep, and it's normal. She does it after every single death. So a tip for you guys, if you are dealing with a patient who's passed away and you're struggling to sleep with the light on. She said it works for her, so it may work for you also. Sleep with the door open. You might want to sleep with the window open. You might want to sleep with the lights on. It does something. It may help you sleep with ease rather than sleeping in darkness. Try and speak to somebody straight away after it's happened. So after the death has happened, speak your emotions, speak your truth. Normally when I have looked after a patient who's passed away, I call my partner straight away and just say, like, I don't know how I'm feeling, like I'm shocked. I can't believe a child has passed away. And as a student nurse, I never experienced the death of a patient. It's only until I started my job in A&E that I experienced my first death, and it was a newborn baby. And when I tell you, I just froze. I was shocked. I was like, whoa. Like, how do you even process? I couldn't even process the fact that a newborn baby who has just been born has passed away. So I just called my partner straight away. I cried on the phone. I said, I can't believe it. He said, Temi, you're going to be all right. You're a nurse. You're going to be fine. You've got this. You're strong. And, sometimes speaking to somebody on the phone straight away, they give you words of encouragement. They motivate you to carry on your job. Because, again, as a nurse, a doctor, a healthcare professional, you're expected to carry on your job as soon as, you've dealt with the patient who's passed away and done the appropriate process in getting them to the mortuary. And if you have any unanswered questions, write it down. It's always good to do a reflection. You can use it for your revalidation. You can use it for your student, what is it called again? Your student portfolios. You can use it for so many things. So if you need to write it down, write it down. If you need to speak to somebody urgently, speak to somebody urgently. As long as you're speaking to someone straight away after the patient has passed away. So you get the emotions, you get the unanswered questions out of your mind. Because you do start thinking, like, how did this patient pass away? Did I do something wrong? Where did we miss the line? Did we give too much medication? Did we not give enough medication? Did we not give enough time? And as doctors, I really do respect them, because they're the one that has to call the time of the death. And to have that responsibility or accountability as a doctor could be so hard. So doctors, if you need to speak to somebody, please do. Nurses, if you need to speak to somebody, please do. Porters, because they're the one pushing the dead body around to the mortuary. And for them, that in itself is such a dreadful job to have to do in that situation. So all supporters, if you need to speak to somebody, please do straight away. Like I said, there's lots of different support agencies out there in the trust or outside the trust to help staff members deal with this kind of situation. So please, please, please use them, because they are useful and there's nothing wrong in using them. I would say every death affects you differently. Like the death of the newborn baby that I had experienced, that shocked me. But the death of a 3-year-old patient that I provided care for all throughout my shift, and they were alive and then they came back dead, that shocked me, because I thought, hold on a minute, I just saw this patient 2 hours ago and they're fine, and within the next hour they've come back and they're dead. And that shocked me. Like, I cried, because I just didn't understand, and it didn't make any sense to me. Like, how is it possible for a child to be in the department, you've done so much clinical observations, they were stable, they were chatting with you, there was nothing wrong with them, for them to come back an hour later and they've passed away? It just shocked my system. And the way the newborn baby shocked me was different to the way this 3-year-old had passed away. And I just thought, whoa. And we all cried, we all hugged each other, we all expressed our emotions straight away after that moment. And we let the parent just do what they needed to do in order to let their feelings out. Some parents go crazy, but you can't stop them from doing that. You just have to let them do what they need to do. Some parents cry, some parents are in shock, they can't believe it. Some parents are appreciative of the NHS, like all parents are anyway, but some children who have a lot of medical needs, they do understand that their child may not live for long. And as NHS workers, we do try our best to sustain their life. And some parents are very thankful for, being a part of their child's life. So don't be so hard on yourself, or don't be shocked that one death will affect you in a different way compared to the other death. Talk about it. Like I said before, talking helps. Like, I don't think anyone understands how much talking about it helps. So if you need to talk to somebody, please do. If you need to write it down, if you continually need to talk about it, please do. As long as it's helping your emotion and helping you, then I would say talk about it. If you need to talk about it to your mentor, your preceptor, the matron, the head of nursing, any doctor that was involved, the consultants. As again, I said, we're a team. So if one team member is affected by it badly or worse than another team member, please just, be supportive of that nurse or doctor or healthcare professional. And don't feel bad for talking about how you feel, because you're a human being. And as a NHS worker, we understand that we're all a team. We have to have empathy for each other as well as patience. So if you need to discuss it again and again and again, please do. I would also say for student nurses, if you've never experienced a death, or you feel like it's too much for you to handle, then you can always leave that situation, because you're a human being as well. But as your student, your mentor should always support you in that moment. You shouldn't be afraid to say to your mentor, I can't do this anymore, I need to go outside, I'm struggling to cope with this, because you're a human being as well. And they should be able to find you some, support agencies, or let you go home early just so you can refresh yourself, because although you're a student, you've never experienced such a thing before, and it might be hard for you to process. Likewise with nurses and doctors, you're also a human being as well. If you need to speak to anybody, please speak to somebody. If you need to have a debrief again and again, you're welcome to do that. If you need to attend, the meeting where all the multidisciplinary team members, if you need to attend that meeting, please do attend it, so that if it gives you peace of mind, if it gives you, reassurance that you've done your part and you've done it well, please attend it. For children, it's quite, I don't know how it is for adults, but for children, when a child passes away, there's a thorough investigation. So when the child passes away, in my trust, we don't touch the body. We just, clean them up and wrap them up, and don't take any cannulas or tubing out, because the coroner needs to investigate why this child passed away, because children shouldn't be dying, or children shouldn't, in an ideal world, people believe that children shouldn't be passing away. So the coroner does an investigation to what may have caused the death. Then they have another debrief where they go into detail about what could have potentially caused it. They go through all the notes, to find out if they attended A&E variously, did they have any community visits, and those kind of things. But I hope my video has helped. If you have any questions or would like to find out what agencies are out there to support doctors or nurses that have experienced death, of a patient whilst at work, please comment down below. I hope this video was informative for you. I hope I wasn't talking too fast. I just thought that this video is necessary because as a student nurse, I didn't have the opportunity to experience the death of a patient until I started my job. And some student nurses may not experience it. So I thought that the video will help you, prepare you for that moment, because, you know, death can happen at any time, unfortunately. So knowing how to deal with it prior to you experiencing it is very key. So I hope my video helped you guys, and I will see you guys later.